Welcome back to King 5 News at 4 o'clock. You know, it's spring, and you know what that means. If you are constantly battling allergies, you might not be too thrilled about the seasonal change.
No, Dr. Olabode Akinsanya from Overlake Medical Center here to talk about what we can all do to fight those dreaded allergies. Thanks for being here.
My pleasure.
Let's talk about some of the symptoms. What are we going to be all feeling very soon, if we haven't been feeling them already?
As part of the symptoms of allergies, it could include things like watery eyes, runny nose, sniffles, sneezing, and if you have things like underlying asthma, your asthma could flare up a little bit.
This time of year, a lot of people say, I don't know if I have a cold or if my allergies are just acting up. How do we know the difference between the two? Or sometimes are they together?
Yeah, sometimes those two can coexist. You know, the cold symptoms can also happen together with the allergies, but allergies are pretty much chronic illnesses, and most times you would be able to tell when it's coming on.
Can you develop new allergies later in life or allergies to new things?
So what can sometimes happen is allergies could be, it's most times due to exposure to different what we call allergens. Those are the things that trigger the allergic reaction. Sometimes it could be exposure to new things that would lead to that. And sometimes what could happen, what we see happening sometimes is immense exposure to things. You could sometimes develop allergies to it.
When I was a kid, I had allergies that triggered my asthma, and I just remember going to the doctor every week to get my allergy shot where they were trying to build up my immunity to the allergens. What happens these days when you get young patients that come in with allergies? Do you guys still do allergy shots or things like that?
One of the first set of things we would want to do is first identify what they're allergic to, and if as much as possible they can avoid that, that would be the first line of treatment. And if they're not able to avoid it, then we go antihistamines, and these are oral medications they can take. And as you said, back in the day, they're allergy shots. They're still allergy shots, but you now have the sublingual. These are medications you can put under the tongue, and it's called allergen immunotherapy, which helps boost your immunity and prevent you from being susceptible to those.
Is there something that we can do? Are there new therapies, new treatments out there, a better way to prevent or treat allergies that we should know about this year as we head into allergy season?
Again, like I said earlier, one of the best ways is to avoid the exposure to the allergens, and if you're not able, it's usually a stepwise management from things like oral medications. If your allergies manifest as runny nose, you could use things like inhaled steroids to help combat that, and if that still doesn't, we move on to the next step, which is the immunotherapy.
I feel like we've been struggling with allergies for years and years and years. Have there been any huge breakthroughs in allergy medicine in the last few years?
There's always breakthroughs all the time.
But like big game changers?
None to the best of my knowledge at this time.
Okay.
Yeah. One day it'll
Someday.
happen. Yeah. Dr. Olabode Akinsanya, thank you so much. We appreciate it.
Thanks so much for having me.